we did a terrific survey on dental continuing education to see what you, the general dentists and dentists out there, what they want and what they're looking for when it comes to dental continuing education and the type of dental continuing education that you and I take, that we all take all the time. So here, the number one reason that I attend dental continuing education programs is to find out about evidence-based studies. That happens to be a very small percentage of people, about 11% right now. To learn the latest and greatest in dental technology, see what's coming in the future. We found that's 16%, but 73% of dentists said that they come to learn about the latest and greatest clinical products that can help them in their everyday practice of dentistry. And that's not surprising to me, because those are the things that I talk about primarily, and it gets, I mean, you know, those, I see the audiences, and this is what they're asking about, and these are the kinds of things that they are looking for, the latest and greatest clinical products, because that is what helps you every day in your practice. So that's not totally surprising to me. I'm not surprised that people don't want to hear that much about studies. Studies are very, very important. Evidence-based, it's become a buzzword. Sometimes it's a politically correct word that we see so far. You know, nobody knows what to do with that right now. But technology is definitely growing, and we're definitely seeing dentists get involved more and more in technology. The funny thing is, dentists are scared of technology, but they know it's all coming. And we'll see this more in the future. Certainly, I've gotten much more involved in technology as we're going, and you'll hear some of that in my programs there as well. The second question, in the last year, I generally attend dental continuation programs that are devoted to one topic only, such as composite resins. That was 38% of the respondents. I like to go to a continuing education program that has a wide variety of topics, so I gain a broad-based education. That was 60% of the folks responding here, and 2% said they go to research-oriented, and those are generally going to be academics and, you know, AADR meetings and those kinds of things. Most of the people in our survey certainly are not academics, so they're looking for a broad-based education as you are there too. And again, that doesn't really surprise me. Many people like the one topic events or lectures where you talk about one topic and really be able to delve into the one topic, and that's all great. But again, you know, there's so much new in dentistry these days. You know, you've got to have a broad base of what's going on. You know, the one topic lectures are really good, but it's not just about composite resins. It's certainly not just about porcelain veneers or anything else like that, or porcelains or CAD/CAM. It's got to integrate into all of your practice there. So I would recommend that you try to get as much of a broad-based education as you can. And the third question in this is, how have dentists been taking their dental continuing education programs? And they checked everything that applied. Not surprising, 68% of them have taken some kind of online education. Now, you've got to be careful with online education, because you've got to see where it's sponsored by. You've got to see if it's free. Generally, sometimes when it's free, not all the time. There are many good ones out there that are completely free, but sometimes when they're free, you know, you may be getting what you're paying for in terms of that. But online education obviously is big. By DVD, and you know, online education DVD, it's great. It's great when those forms of education especially can demonstrate something to you rather than just being a straight lecture or a PowerPoint, which can get kind of boring by all means. But you know, those, I get this all the time from people who tell me, oh, dentists going to lectures, that's pretty much dead. 97% of the respondents said that they have gone to lecture in the past year. So live lectures is not dead, because it gives you the ability to ask a question of the lecturer, or really to kind of think through, and also to network. I think a lot of dentists I know, when they come to my programs, you know, it's not just about my programs and me getting up to speak. I actually try to get my audiences very involved in the program there too, and really make them think. But the networking that happens at a break, over lunch, and those are the kinds of things, especially when there are exhibits around, it's incredible what can happen. And I think, you know, dentists will always be going to lectures for a very long time. 61% have gone to a hands-on workshop. You know, we give 50 courses a year, hands-on workshops on Botox, dermal fillers, TMJ, therapeutic, Botox therapeutic, and bruxism, and all different kinds of aspects of facial aesthetics, as well as I give a lot of porcelain veneer hands-on especially with the next generation crystal veneers, the new no prep or minimal prep education for that kind of a program there too. So people love hands-on workshops. I would encourage hands-on workshops. For example, in our case with the American Academy of Facial Aesthetics and Botox, it's the only way you're going to learn about Botox is by actually doing it on patients that you bring yourself. 39% do self-study programs and 26% go to live patient treatment programs. Again, those are great programs, and we firmly believe that the best live patient education is absolutely when you bring your own patient, because then you take that patient home, can see what happens to them, especially when you're learning about something like facial aesthetics. But even if you're doing porcelain veneers or any kind of dental aesthetics, really important. Sure, you can put veneers on a model. Sure, you can inject Botox into a dummy or into a patient, and that's not the same thing. Don't take that wrong. But you can inject it into a non-live dummy or into a patient that you'll never see again. But at that point, you might as well inject it into an orange until you can really see what's going to happen on a patient that you know. Then that really is going to go ahead and help you learn, because you've got to take a look and see what happens after it. You can put veneers on a typodont, you can put veneers on a person you'll never see again, but to see them again in a week's time when all their facial structures and everything else have kind of accommodated themselves to the new veneers, that really is the best way to learn, especially when you're doing live patient, is try to bring your own patient all the time here. So that's a wrap up of how dentists learn and what currently they like for dental continuing education. I urge you, and that's the only way to grow yourself, grow your practice. Your best investment always is dental continuing education in yourself, and especially make sure you bring your team members with you, because you can all grow as an office together.